Hi, I'm Kelly Villegas with Focus Neuro Rehab, and today I'm going to show you some ways to do some manual therapy on the lower part of your arm and hand to help prevent carpal tunnel syndrome, ulnar or cubital tunnel syndrome, and to help improve your hand function if you have trigger fingers. So trigger fingers are basically when the inflammation around the tendon sometimes causes a trigger and then you can't extend your finger. Now, if your trigger is really bad, you may need surgery. So I definitely suggest having a hand therapist or a hand surgeon take a look at you. But always try hand therapy first because a lot of times we can help with this. But let me show you some nice techniques to help you, hopefully to help improve your function there and get rid of that trigger finger, okay? So the first thing I want to do is introduce you to gua sha tools. There is a set of 6 gua sha tools on Amazon, and they look something like this. This is just a few of them. I don't have all of them here. We're going to start with this one, and we're going to start on the ulnar nerve. So the ulnar nerve comes from the neck into the arm. It goes through the cubital tunnel here, and then down into the hand and these 2 fingers, okay? So we're gonna start with some areas that are common areas of entrapment for the ulnar nerve. And so we're gonna start with the curved edge, and you're gonna just start scraping that towards you. If you want, you can use cream, but you don't have to, okay? So you're gonna kinda start going down into the forearm, come across the side of the elbow, and then up into the arm, okay? And you can see that I'm getting pretty red from doing this, okay? If you get some tingling and numbness from this, it's a pretty good sign that you might be having some issues, but that ulnar nerve is also very close to the skin. So just, be aware of that and be careful. Try not to overly irritate it, okay? Now you can see I got some nice redness going on there. So that's the ulnar nerve, and then we're gonna go on down to the hand. And so I'm gonna have you start working on the side of the wrist, okay? And again, I wanna see some redness getting into the forearm and the upper hand, into the hand and just around the wrist. You can see I have some redness now. All right, so that's the ulnar nerve, and then now we're gonna do the median nerve. So the median nerve comes a little more anterior. It comes under the pronator teres muscle and then into the hand. So we already kind of worked this area, so let's work here now. So you can see how I'm using the concave edge now, and I'm just lighting up beautifully here. You can see I'm getting pretty red. So you're gonna kind of come in this direction across the top of the elbow now. I have a lot of irritation there, so this is good for me. Okay, and then just work your way down. You can use different directions of this little gua sha tool if you want to get a little deeper. And then we're gonna go into the hand. So for the hand, I like to use this tool. This is a great tool for the hand. And so you're gonna kind of like you're scooping ice cream out of the hand. Okay, so start kind of deep in the palm and just work towards the carpal tunnel. The carpal tunnel's right here. You can also go across the carpal tunnel. This is so good for your tendons and ligaments here. And then if you want, you can start using this part, and then you're gonna start at the fingertips and just work down the tendons into the carpal tunnel area, okay? Okay, you can also go down the sides of the fingers, working each of the sides. I'm just kind of showing you. I'm not gonna spend a lot of time here. And down like that. You can also use this edge for that tendon. Now, if you have a trigger finger and this is too tender for you, then switch out the tools and use this one. It's not quite as beveled. And you can also go kind of in between the fingers. So kind of like this. Okay, I'm just kind of showing you slowly so you can see how I'm doing it. Okay? And you should get some redness also in the hand, okay? You can also use this end of the tool to kind of work that thick muscular area of the thumb. Very good, you know, for that area of the thumb to do that, okay? So there's a couple techniques on using the gua sha tools for the hand. Now, if you have a trigger finger, I want you to go and watch my carpal tunnel video because it teaches you about how to do a lumbrical release. And so it's very important, if you cannot hyperextend your fingers and get into this position nice and tight, then that means your lumbricals are probably too tight, and that's causing your trigger finger. If your lumbricals are tight and you're using your hand like this all the time, your tendon is not getting full tendon excursion, okay? So you should be able to do a tendon glide like this with nice and tight and full extension, okay? So if you're not doing that, definitely go to that carpal tunnel video and check it out so that you can learn how to stretch the lumbricals, okay? And if you have any questions, let me know, and I'll be glad to try to answer them. Have a great day.